Hi and Assalamualaikum everyone. Do you ever heard about Streptococcus pyogenes? If not, let me introduce to you about Streptococcus pyogenes. Firstly, let's begin by looking at the key characteristic of Streptococcus pyogenes. Streptococcus pyogenes is a gram-positive bacteria, which means it has a thick peptidoglycan cell wall, which means it retains the crystal violet stain. It is also in spherical in shape, which also known as cocci, and typically arranged in chain. Streptococcus pyogenes also classified as facultative anaerobe, which means it can survive in both oxygen-rich or oxygen-poor environment. This allows the bacteria to adapt easily in different parts of human body. Another characteristic is Streptococcus pyogenes is beta-hemolytic, and also it belongs to Lancefield group A based on specific carbohydrates found on its cell wall. Next, transmission of Streptococcus pyogenes. The transmission of Streptococcus pyogenes is very efficient and it spreads easily through close contact. There are three main modes of transmission, which is first, respiratory droplets, direct contact, and indirect contact. First, the most common way is through respiratory droplets. This is happen when an infected person sneezes, cough, or even talks. They will release tiny droplets into the air. So, when another person nearby breathes them in, the bacteria will enter the body and start infecting the throat. Next is direct contact. Direct contact happens when you touch an infected area such as skin wound or come into contact with saliva or nasal secretion from an infected person. This is common among children because they usually share toys or usually have close physical interaction. Lastly, indirect contact through contaminated objects, which also known as fomites. This happens because things like used tissue, towels, or shared glasses can carry bacteria in period of time. So if someone touch these items and then touch their face, especially around mouth or nose, the bacteria can easily enter the body. When it comes to Streptococcus pyogenes, prevention is really important because currently there is no vaccine available for this infection. So instead, we focus on breaking the chain of infection. First and the most important step is personal hygiene. As you guys know, this bacteria spreads easily through touch and droplets. So, washing your hands using clean water and soap for at least 20 seconds is very effective, especially after coughing, sneezing, or before eating. Another thing that we can practice is good respiratory habits, such as covering our nose or mouth using towels or tissue during sneezing or coughing. And also, simple practice like don't sharing utensils such as towels also can reduce the risk of infection. Next, another step that we can practice is wound care. Even small cuts or scrapes, we should be cleaned immediately and covered with clean bandage. This helps to prevent the bacteria from entering our body through the skin and that can cause skin infection. Okay, lastly, how we identify Streptococcus pyogenes through lab identification. So there are a few tests that we can conduct, such as gram stain, hemolysis identification, catalase test, bacillus test, PYR test, and Lancefield grouping. So let's go deeper one by one. So when we perform gram stain and shows that the bacteria stain the purple color, it shows that Streptococcus pyogenes is gram-positive bacteria, cocci, and usually they will arrange in chains. Then we perform catalase test. Streptococcus pyogenes is a catalase negative, which means that they does not produce bubble when hydrogen peroxide is added. This helps to distinguish Streptococcus from Staphylococcus. After that, we will perform the more specific tests such as bacillus test and PYR test. Bacitracin test shows that Streptococcus pyogenes is usually sensitive to the antibiotic bacitracin, so it means that they cannot grow around the disc when we put the bacitracin disc on the cultured agar. PYR test is a rapid colorimetric biochemical assay used to specifically identify Streptococcus pyogenes, which is grouped as Streptococcus and Enterococcus species. So, the PYR test is commonly used, which Streptococcus pyogenes will have positive result, which turns the disc bright red and giving faster confirmation to confirm that it is Streptococcus pyogenes. Lastly, for definitive identification, we will use lens fit grouping, where group A antigens are detected using latex beads that clamp together if Streptococcus pyogenes is present. So, when the agglutination happens, it shows that Streptococcus pyogenes is group A Streptococcus. In conclusion, Streptococcus pyogenes can cause infection ranging from mild to life-threatening disease, but with proper hygiene, early diagnosis, and complete antibiotic treatment, this disease can be prevented. So, understanding this bacteria about Streptococcus pyogenes is so important to protect public health and ensure effective management of infection. So, that's all from me. Bye!